Hi everybody, this is Bethany, and today I'm going to be sharing my video presentation on the skill assessment sheet that I designed for airway screening. I remember learning a little bit about this in hygiene school, but it wasn't until after I graduated and I started working in private practice for a few years that I had an opportunity to work with a doctor who has a very strong emphasis in restricted airway and sleep apnea and things like that. So I'm taking from some of the things that I've learned over the years and some of my own research and putting them together in a skill sheet. So I hope you enjoy. Here's a copy of my assessment form that we'd be using. The task at hand is patient airway screening, and the armamentarium we're using is a mouth mirror, overhead lighting, and patient health history and sleep questionnaire. The criteria is broken up into 3 areas. The first one is professional practices. And the next section that we have is airway assessment, which includes the review of the patient's health history and sleep questionnaire, interviewing the patient, and performing a clinical exam. And the last section is patient education, and that's where the student would be relating their findings in the clinical exam and the paperwork that they went over with the patient and relating that to the patient's airway health and any recommendations that they would have. My husband was kind enough to offer himself as my patient today since I'm off of work and away from the office. And so starting off, I'm reviewing his health history paperwork that he filled out for me as well as his sleep questionnaire. And I'm asking him questions about his history with high blood pressure and acid reflux, as he circled that he has both of those. And he's explaining to me that both are very well controlled with the medication that his doctors prescribed him. I'm also asking him about some of his answers on the sleep questionnaire, as he noted that he does notice snoring a little bit at nighttime and a little bit of daytime sleepiness. At this time, I perform a clinical examination where I assess him for any occlusal wear due to acid erosion or bruxism. I'm also checking out his tongue to see if there are any signs of scalloping, a tongue tie, and I'm also going to have him stick out his tongue so I can check his Mallampati score and really get a good view of his airway. And last thing I'm going to do before I sit down is check his neck circumference and see if there's any presence of nasal stenosis or collapsed nasal passageway when he breathes. And then afterwards, I'm going to sit down with him and just go over my findings and educate him. All right, so Fred, now that we've done your clinical assessment and I've gotten a chance to look through your paperwork, I do have a few things that I wanted to talk with you about as far as your airway goes, okay?
Okay.
So looking over your paperwork, you had let me know that you do have a history of acid reflux and history of high blood pressure. Thankfully, both of those things sound like they're pretty well managed with the medication that your doctor has you on, right? When I was looking inside of your mouth, I saw some things that caught my attention. I definitely noticed where you've got some wear on the chewing surfaces of your teeth, and some of the enamel on your teeth actually has some thinned areas from acid eroding the areas just over time. So that could have happened before you started your acid reflux medication.
Okay.
But it's a significant finding for us. Another thing that I noticed when I was looking at your tongue is that you have something called scallop tongue, and that just means that the shape of your tongue around the borders is a mirror image to the shape of your teeth. So most people develop that when they're pressing their tongue up against their teeth for a long period of time. And we've seen a connection where that tends to happen in people that are trying to create a better airway for themselves. The last thing that I noticed when I was looking at your airway is that I couldn't really see your airway very well. We would classify it as a Mallampati class 3. And that just means that I could see very little of the back of your throat. And since I can't see it very well, that tells me that you have a little bit of a restricted airway where you may have some challenges breathing, as well as somebody who has more space back there. Okay. So I've got some recommendations for you. The first thing that I would recommend is checking in with your medical doctor, because what we're learning about these different findings is if you're having trouble breathing the way that you should, particularly at nighttime when you're sleeping, what can happen night after night is a reduced amount of oxygen can be highly linked to high stress on your heart. So instead of you going to sleep at night and getting the rest that you need, a lot of times that restful period can feel like more like running a marathon or climbing a mountain. So we need to find a solution to make sure that everything is operating as it should when you're sleeping. So checking in with your medical doctor would be a great first step. He would probably order a sleep study with you so that we can get a baseline idea of your quality of sleep and how much oxygen you're taking in at night. If they're seeing from your sleep study where you're having any signs of an obstructed airway like sleep apnea when you're sleeping, your doctor may recommend something like a CPAP machine. Or if that doesn't interest you or you have trouble tolerating one, you could also talk to us about making a custom oral appliance for you. And the way those work is they advance your lower jaw forward a little bit so that we can open up your airway so that you can breathe the way that you need to when you're sleeping at night. Okay. Another thing that we might talk about is referring you to a myofunctional therapist, and they specialize in positioning of the tongue that's going to create a more ideal environment for your airway. So I think a good first step would be to check in with your medical doctor. And then once we get a sleep study and we find out what your results are, we can go from there. Okay. Do you have any questions for me at all?
If I choose not to go check in with my doctor, does that change my normal dentist appointments?
No, but that's a really good question. If you chose not to investigate your sleep at all, one thing that could happen is you could continue to suffer from an obstructed airway while you're sleeping at night. And so it's going to increase the risk of you developing more serious issues with both your teeth and the rest of your body. So you may experience an increased wear on your teeth over time, and you may start to have more complications with your high blood pressure and just the overall feeling of restedness when you wake up in the morning and when you're going throughout your day. Okay?
Okay.
All right. Well, thank you so much for letting me take a look at that, and then we'll go ahead and get going with your cleaning, okay?
All right, thank you.
All right. And to end things, I just wanted to include some visuals of acid erosion and occlusal wear. Scallop tongue, you can see that here. I also wanted to include an illustration of the Mallampati scores and a picture of nasal stenosis. Reach out to me if you have any questions, and have a great day.